Social isolation refers to the condition of being disconnected from social circles, often resulting in limited or no social interaction. Social isolation affects 7.7 million of community living older adults in America. And the number of older adults experiencing social isolation is expected to rise along with the increase in older adult population. My name is Sarah Peabody, and in this video, I will guide you on how to choose a tool to assess socially isolated patients. Why is it important to measure social isolation? There are 3 reasons. First, social isolation is a significant health problem for older adults, and using a tool helps us recognize and address this issue. Second, using a tool will help us differentiate between social isolation and loneliness. These 2 experiences have different implications and require different approaches for assessment and intervention. Number 3, measuring social isolation helps us better understand its true meaning, recognize its impact in older adults, and ensure appropriate interventions are implemented. When evaluating and recording responses to social isolation, there are 3 internal factors to consider. Number 1, healthcare professionals need to have the knowledge and skills to effectively identify and address social isolation. These include understanding the signs and symptoms and impact of social isolation, as well as being a support and make appropriate referrals. Second, it is crucial for healthcare professionals to have a positive attitude in regards to social isolation. They should prioritize the assessment and documentation process, actively listen to patients, and show empathy. Lastly, a sense of adherence to hospital guidelines serve as motivation for healthcare professionals to accurately assess and document social isolation, thus ensuring comprehensive care. External factors are also crucial for comprehensive assessment and documentation of social isolation. External factors such as the use of organizational guidelines, such as natural language processing or NLP, documenting living alone in electronic health records can assist in identifying social isolation. However, relying solely on the indicator of living alone may not always accurately identify patients at risk. The demanding nature of healthcare workload can limit the time and resources available for assessment and documentation. Lastly, the patient attitudes and their willingness to acknowledge isolation can affect the accuracy of the information provided. So in this video, I will discuss a tool called PROMIS, which stands for Patient Reported Outcomes Measurement Information System. PROMIS is distributed by Health Measures and was developed and evaluated by the National Institutes of Health. During my research, I found that the use of social isolation tool is not common in acute care setting. However, when I asked my CNS preceptor, she mentioned that the social workers are primarily responsible for screening social determinants of health, including social isolation, and not the nurses. The PROMIS tool is mostly given to patients in primary care or outpatient settings. Previously, it was used by nurses in adult care coordination program. This is, during admission process for older adults transitioning from hospital to home or MPACs. However, I discovered that nurses stopped using it after they redesigned the program. The accuracy of PROMIS SI depends on the administration method and the number of questions asked. By asking more questions, the accuracy of the tool increase and reducing the chance of errors, increasing confidence in the respondent score. EHR format of PROMIS is called CAT, or Computerized Adaptive Testing. Patient can enter their answers using an iPad in Epic, or nurses can also use the iPad to interview the patient. Patients can access these measures via Mayo Portal app. The measures can also be assigned to patients in a planned way or automated. Clinicians can review the individual responses over time in the patient's chart and can be trended in a synopsis view along with other clinical data. And this is the example paper format of PROMIS SI with 14 questionnaires with a scoring cutoff points of 20 to 50 with the normal limits, 60 is mild, social isolation, 70 is moderate, 80 is severe. For my selected tool, it is called the Social Isolation Scale, or SIS, developed by Nicholson et al. In 2020. This is the sample SIS questionnaire. Now we'll explain a little bit further here and in a little bit. The scoring cutoff points is less than 9, indicates social isolation. 10 to 15 is risk for social isolation. Here are the comparison of the two tools. You guys can stop the video and read this on your own. Both tools measures different aspects of social isolation. PROMIS is available in short form, or SF, and computer adaptive test, or CAT, whereas SIS is available only on paper-based or interview. PROMIS SI has 14 in CAT, and short forms can be done with 8, 6, 4 questionnaires. SIS, on the other hand, is 6 questions, and both of them use 5-point Likert scale. In PROMIS SI, time to complete the questionnaire would be around 5 seconds, and it's designed for 18 years old and above. And on the other hand, SIS, time to complete is ranging 3 to 5 minutes, and it's designed for 60 years old and above. If you take a look at this table I made, both tools have decent validity and reliability. It looks like they're almost the same here, except for this number 1 study. I used 2 articles for SIS and 1 article for PROMIS. But because time is short, I will show you the definition for validity and reliability at the next page, which you can pause and read it on your own. So in the context of validity, here convergent and discriminant were used, and for reliability, test, retest, and internal consistency was also used. I was just going to say that the discriminant validity here needs to have no correlation or weak correlation in order to be valid. Discriminant validity measures a particular construct that does not correlate with the test that measures different construct. So you want this to be weak. And so, for example, the SIS score showed weak correlations with the total score of the satisfaction with life scale. So it just means that older adults that are satisfied with their life should have no or lower risk of social isolation. And this is the validity definition and reliability definition. You guys can stop this on your own and can read this. And in the context of quality here, I use the ease of administration, scoring, and ease of interpretation, EHR use, and biases. You guys can read this on your own, but both of them have pros and cons here. PROMIS SI is embedded in Epic, and SIS requires paper or interview skills. Most of the study I research have some limitation or biases. I put hard for paper format or SF here, and EC, and CAT. Look at here. Just because that the CAT will add all the total scores right away, but for SF it's just hard because you need to have a table scoring, and it's just tedious to look at. Here's another thing that I would like to discuss. According to Voltorda et al. In 2016, social isolation encompasses various dimensions. And in their article, the authors classified different measures of social isolation into 2 dimensions. So one is whether the instrument covers structural or functional aspects, and the degree, and number 2 is the degree of subjectivity that required of respondents. This classification helps clarify the scope of questionnaires used in the literature and allows for comparison between them. So I created this table to compare SIS and PROMIS SI. SIS measures the structural or the quantitative aspects of social relationship, such as the density, duration, dispersion of social relationships. And on the other hand, the function dimension, which represents qualitative aspects, for example, instrumental help, emotional support, or advices. So if you look at the SIS here, it actually covers 3 dimensions, and the structure, function, and subjectivity. In comparison, PROMIS SI only covers the functionality and subjectivity. Additionally, some of the questions in PROMIS SI also captures loneliness, except for SIS, and both of them are validated to use in older adults. With this in mind, when searching for a tool to measure social isolation, it's important to clearly define what aspects of social isolation you want to measure and the goals of study or your intervention. This will just help it will help you choose the right tool, because different tools may focus on different aspects of social isolation. I believe that the issue at hand is not about which tool we need to use, but rather the importance of addressing social isolation in our community. My recommendation is to use both tools, as they show similarity in terms of validity, reliability, and quality. If you're in an outpatient setting, PROMIS SI is very useful to assess social isolation. Not only it's readily included in the EHR, it's also useful to track the results over time. And on the other hand, if you are in the acute setting and need to assess the patient for social isolation quickly, I think SIS would be a better fit. Another recommendation is to make sure align the selected tool with research question or intervention. You need to define your research questions first, so you can identify the specific aspects of social isolation you want to measure or capture. I will just make sure that the selected tool is suitable for measuring the desired outcomes and can provide meaningful insights on your study or intervention. Lastly, you need to follow up with these patients, as the levels of social isolation can fluctuate over time. There are benefits to patients, nursing practice, and clinical sites in using both tools. The benefits for patient would be improved well-being, personalized care, and early intervention. It also provides benefit to nursing care, such as providing holistic care, enhanced communication, and trend monitoring. Also, benefits in clinical sites. It provides quality improvement, patient-centered care, and enhanced reputation. In summary, we did learn a lot today, but let me just summarize. Assessing and addressing social isolation in older adults is crucial for their well-being and can lead to improved patient outcomes. We learned about 2 tools today. It's the SIS, which is Social Isolation Scale, and PROMIS SI, which stands for Patient Reported Outcomes Measurement Information System. And that SIS measures belongingness and connectedness, whereas PROMIS SI focuses on perception of social isolation. There's also internal and external factors that affects documenting responsive to these tools. Lastly, when selecting an assessment tool, you need to measure the social isolation. Depends on your setting. SIS for acute setting and PROMIS SI for outpatient. That's my recommendations. Lastly, it's also crucial to align the research question or intervention and follow up with these patients. Thank you for listening, and here are my references. Thank you.